Page Architects has been around for over 100 years now. From the very beginning, we've focused on the multidisciplines. One of the major ones has been hospitality and the healthcare. By focusing on both of those together, we're able to bring them together into one project. So we have a healthcare environment that focuses not only upon the healing arts and those sorts of things, but brings the hospitality into it, so the patients are both receiving health treatment, but they're comfortable in that environment. The Lakeway community is a very young and growing community, but it was underserved. There was no hospital in that immediate area. So we were able to work with not only the community leaders, but the community as a whole to create a facility that was home to them. Healthcare environments are very unique in the way that they're used. So we wanted to take advantage of the importance of this building and really get a strong community involvement, community perspective from everyone within the community. We worked with both doctors, nurses, and different clinical personnel to figure out how they work within the space, how they use the building, so that we can take those needs and integrate those into the design to make sure we were creating a place that they were most able to use and work in both efficiently, comfortably, and pleasingly.
But we really started out as we were on a rural site in the landscape, in the country, and being in the Texas Hill Country, and the way the community thinks about their community and feels about it. That was really our touch point for the design.
One of the most significant things that we look for with regard to a healthcare environment is making sure that it responds to the human condition, that it acknowledges all of those essential things that we need in a quality environment, everything from daylight to textures to smells to all of the things that really creature comforts. You know, what are the things that really make people feel safe and secure, warm, and all of those things ultimately conclude to an environment which promotes healing, promotes the outcomes to be much more desirable from a patient's perspective. And that includes the family as well. It doesn't just include the patient, but the whole sort of sphere of the patient includes the caregivers, and families and friends. And we consider all of those things from the minute you park to the ultimate arrival of where you're going within the hospital. Outdoor spaces, daylight, all of those things are essential. We factor all of those in as part of the process.
The hospital is, you walk in and you have a nice high daylighted space with natural stone flooring and a natural wood screen behind the information desk, wood millwork, lots of really rich wood accents that break up the linear pattern of the front main lobby as people walk in. There's a healing garden that is visible from the first floor and the lower level where our surgery unit is. It's every window on those levels on one end of the building. You can see this healing garden and that stone. Our exterior was natural stone. We brought a little bit of that into the building and then carried the natural wood up to the main, the nursing and the patient floors.
So we made sure that all of the patient rooms have immediate access to daylight, natural light, everything from the front entry process all the way through to the eventual patient room. Once you're within the patient rooms, you have access to both the daylight we've spoken about before and natural materials, natural woods, laminates that mimic those woods. The environment should be warm, comfortable, make the patient feel like they're at home. We were able to accomplish that through the use of laminates and solid surfaces that had nice, rich, deep tones to them, nice, warm, comfortable things so the patient felt at home while they were in there, but still providing a durable surface that could withstand the abuse of the hospital.
Healthcare providers, it's been determined in studies, have concluded that if they are proud of the place that they work, if they are inspired by the environment by which they're working, they provide better care. They do better work, and it's whether it's irrespective of whether it's a hospital or our office, for example. The people are inspired when they feel connected to their environment, when they're connected to their facility, and so design is all part of that, and design is inclusive of those immediate things that we can touch and see, but there are also the things that are outside the window and the views that we get. So it's not just the patient, it's not just the family, but it's taking care of those care providers, because those are the people who really do go through a lot of stress and a lot of hard work. And so if you can make their environment better and more comfortable, more pleasant, then you're going to have better outcomes.